Intermittent fasting. It's the wellness trend that everybody's talking about, from celebrities to fitness influencers. But what if I told you it's more than just a weight loss hack? For people struggling with small intestinal bacterial overgrowth, or SIBO, intermittent fasting might be the gut healing tool you've been searching for. But is it all good news, or are there risks that you need to know about? Stick around because today we're breaking down the pros, the cons, and the practical tips for using intermittent fasting to manage your SIBO without wrecking your health. Hi, friends. I'm Dr. Michael Arthur, otherwise known as the Mind Belly Doc, and welcome back to the channel where we dive deep into the gut health secrets your doctor might not be telling you. If you've been battling IBS or SIBO, dealing with bloating, gas, discomfort, or that frustrating cycle of flare ups, you know how hard it can be to find relief. Could intermittent fasting be the missing piece? In this video, we'll explore what the science-backed research says, who should give it a try, and how to do it safely without making things worse. First, let's get on the same page. Intermittent fasting, or IF for short, isn't a diet. It's a pattern of eating where you alternate between periods of eating and fasting. Popular methods include the 16 to 8 schedule, where you fast for 16 hours and eat within an 8-hour window, or the 12 to 12 approach, which is a bit gentler. The idea is to give your body more time to rest and repair rather than constantly digest food. Now, why does this matter for SIBO? Well, let's talk about the science. First and foremost, we need to talk about gut motility and the MMC, or migrating motor complex. Stay with me, don't go anywhere. I know that's lots of gobbledygook medical terms, but we're going to break it down. Now, during fasting, your gut's migrating motor complex, or MMC, kicks in. Think of it like a cleaning crew that sweeps out leftover and unabsorbed food and bacteria from your digestive tract. This process doesn't fully activate until you've been fasting for at least 90 minutes or more, which means spacing out your meals or fasting can help reduce bacterial overgrowth. Second, let's talk about how IF can lead to less fermentation. SIBO loves fermentable carbs, things like grains found in breads and pastas, as well as some fruits and veggies. Now, by limiting the time bacteria have access to these carbs, you reduce fermentation, and with it, you limit its byproducts of bloating, belching, and/or gas. And third, it can reduce inflammation. Fasting has been shown to lower systemic inflammation, which can't be a big deal for anyone dealing with gut-related issues like SIBO. All right, let's break down the potential benefits of intermittent fasting for SIBO sufferers. The first and most obvious benefit of IF is that it can bring about symptom relief. Many people report less bloating and fewer flare ups because fasting gives the gut a break from digestion and allows the MMC janitor to get to work. When we eat, we tell that janitor to go on break. This facilitates the digestion process because the sweeping movements and the cleaning waves stop in order to allow for full digestion into smaller little particles of nutrients that can actually be absorbed. However, this comes at the cost of not sweeping out potential pathobionts that have found their way into the small intestines. Now, the second major benefit of IF is that it allows for gut rest. Fasting lets your digestive system recover and recalibrate, while the migrating motor complex, or the janitor, if you will, starts its activity approximately 90 minutes after the last meal or snack eaten. We usually recommend, in practical terms, that you ensure at least 3 to 5 hours between meals and incorporate an overnight fast of 12 hours for example, from 7 p.m. to 7 a.m. These breaks from eating give the MMC sufficient time to function properly, especially if your MMC has been damaged by your bacterial overgrowth. We find this to be especially true for IBS sufferers whose symptoms started even up to 6 months after a food poisoning event or viral gastroenteritis, or even after the dreaded C word, COVID. Now, the last benefit of IF is that it naturally lowers inflammation. Less inflammation can mean not just better gut health, but better overall health. Did you know that your body is biologically geared to become inflamed after eating? Yes, indeed, my friend. And to top it off, we experience both short term and long term inflammatory responses every time we eat, whether it's a big meal or a small one, whether it's a healthy meal or junk food, or even just a small snack. This inflammation is part of the body's mechanism to manage sugar uptake and activate the immune system, particularly in response to ingested bacteria. Oh, yes, dear friend. Every time we eat, we are ingesting bacteria, no matter how clean your hands, your dishes, or your food is. Another enlightening fact shown by the PREDICT study in 2021 in the journal American Society for Nutrition is that individuals that have a greater BMI and or body fat percentage tend to have even more inflammation after eating when compared to thinner counterparts eating the exact same meal. So if you're carrying a few extra pounds down there, especially pounds around the midsection, then this inflammatory effect of eating is something to keep in mind from one day to the next or from one meal to the next, as the inflammatory signals are going to be stronger and their effect through the gut barrier is going to be greater. Now, before you start fasting like a pro, let's talk about the potential downsides, because it's not all smooth sailing. Hunger-induced overeating. This is the number one thing that I see as a problem with my patients over the past few years, is that long fasting periods can lead to binging during your eating window, which might make SIBO symptoms worse. This, of course, can be more difficult if you are overweight and binging inside of your eating window. Nutritional deficiencies. If you're not careful, fasting can make it harder to get enough essential nutrients, especially if you're already on a restrictive diet for SIBO. Hormonal sensitivity. For some people, especially women, fasting can disrupt your hormones, leading to irregular cycles or worsened thyroid or diabetic issues. I recommend talking with your doctor or a dietitian about IF before undertaking it, particularly if you're perimenopausal, menopausal, or have thyroid or diabetic issues. Pre-existing conditions. If you're underweight, if you're pregnant, or you have a history of disordered eating, then intermittent fasting is definitely not going to be a good idea. So, keeping these pitfalls in mind, how can you make intermittent fasting work for you without triggering new problems? I always recommend that you start small. Begin with a 12-hour fast, like from 7 p.m. to 7 a.m., and see how your body responds. Gradually extend your fasting window if it feels right. Folks, we have to listen to our bodies here. If it doesn't feel right, don't move the fasting needle forward. I found that patients do best by increasing their fasting period by 30-minute increments up to a maximum of 16 hours in cases with SIBO, EMO, or ESO. Trying to fast longer than 16 hours will condense down your eating window too tightly, and it usually lends itself to problem number one that we already discussed as a pitfall, that hunger-induced overeating. Now, another way to make IF work for you is to choose nutrient dense foods. During eating periods, prioritize SIBO friendly meals that are low in fermentable carbs but packed with nutrients. You can download our free guide in the description below that contains a list of the no-nos for now. These no-nos contain the highest amount of fermentable carbs and will cause the most problems out of the gate for people with SIBO. If you're starting IF as a pattern of eating, make sure to support your gut. Work with a healthcare provider to include gut healing practices like the right probiotics or antimicrobials. And remember, not all probiotics are SIBO friendly. In fact, the greatest majority are not. But last, and certainly not least, stick to a schedule. Consistency helps your migrating motor complex do its job. So avoid snacking throughout the day or even throughout the night. As we teach in our step-by-step online course, The Mind Belly Blueprint, sometimes it's the schedule of eating that is even more important than what you are eating. At the end of the day, intermittent fasting is just a tool. It's not a magic fix, but if you're curious about trying it, start slow, listen to your body, and work with your healthcare provider to make sure it's a safe and effective part of your SIBO management plan. Remember, it's not one size fits all. Managing SIBO can feel like solving a complicated puzzle, but intermittent fasting might just be one of the missing pieces. If this video gave you some clarity, give it a thumbs up, hit subscribe, and share your thoughts in the comments below. Thanks for watching, and remember, healing your gut is a journey, but you don't have to do it alone. Be well.